Hello and welcome to OET Speaking Unlocked by Kirti Institute. I'm so glad you're here because this series is designed to give you everything you need to walk into OET speaking test. Not nervous, not confused, but prepared and confident. This is video 1 and we are starting with the most important thing, understanding the test itself. Before you can perform well in any test, it's important to understand what you are walking into. So today, we are going to decode the OET speaking test together. By the end of this video, you'll understand OET speaking test format, how preparation time works, how you're going to be assessed, and what grade B looks like in numbers. So let's get started. OET speaking test is different from most English speaking tests. You're not going to speak on random topics, but you'll do what you already do every day as a healthcare professional. Yes, you'll speak to your patient. OET uses a role play format. You play your professional role as a nurse, doctor, pharmacist, physiotherapist, whichever your profession is, and the person sitting across from you, called interlocutor, plays a role of a patient or a carer. The entire speaking test takes approximately 20 minutes, which includes warm up session, preparation time, and 2 role plays. The test is profession specific. Materials are designed specifically for your profession to meet your speaking requirements. And the most important thing is that your role plays are audio recorded and marked later by at least 2 trained assessors. Now, these 20 minutes are divided into 3 phases. It begins with warm-up session. Warm-up session runs for about 2 to 3 minutes. The interlocutor checks your identity and asks you few questions about your professional background. And I want you to listen this that warm-up session is not assessed. I repeat, your performance in warm-up does not affect your score. This is brilliantly designed to calm your nerves. So be relaxed, deep breath, and enter into phase 2. Phase 2 starts with a role play. The interlocutor will give you a role play card, and you will have 3 minutes of preparation time to read and prepare for the consultation. Then the role play card remains with you, and you will have 5 minutes of consultation time. And this part is fully assessed. Then you have phase 3, which is another role play card, the same format with different scenario. The interlocutor takes first card back and offers you another card with different scenario. Again, you have 3 minutes of preparation time and 5 minutes for communication. This role play 2 is also fully assessed. I hope I'm clear. Now let's see how candidate card looks like. As you can see on the screen, this is a card of a medicine, but the format remains same for all 12 professions. So at the top, you will see the candidate card number and your profession. Below that, you'll find the setting, which helps you to understand where the conversation is taking place. Local clinic, patient's home, hospital ward, accident and emergency department, ICU, where exactly. Then you have the patient context. Here it is. We call it patient's background, which helps you to understand the patient's age, problem, diagnosis. Possibly you may understand the patient's emotions, which will help you to design your language and tone throughout the conversation. This also helps you to understand whether you speak to the patient or the carer. Then there is a tasks. Tasks guide your conversation, helps you to understand how to begin and how to proceed. Try to cover everything provided into the tasks because they are given for a reason. However, it is not mandatory that you cover all the bullet points within 5 minutes. Okay, fine. The next is assessment criteria. And each and every candidate should be aware of how they are going to be assessed for their speaking test. There are 2 sets of criteria, linguistic criteria and clinical communication criteria. Linguistic criteria is scored out of 6, whereas clinical communication criteria is scored out of 3. Linguistic criteria assesses your English. Clinical communication criteria assesses how you communicate as a healthcare professional. And we are going to see this criteria in detail just in a while. Most of the candidates target grade B as it is accepted by most registration bodies. So, in order to secure grade B, which is 350 out of 500, you need to secure 5 out of 6 in linguistic criteria and 2 out of 3 in clinical communication criteria. Now, grade B is not the perfect score actually. Okay, perfect is grade A, excellent, highly effective communication, near native proficiency. Grade B is good. Okay, and it is required for your registration. It means that your communication is effective in healthcare sector, although you may make minor lapses, but that doesn't impact understanding. Excellent. Grade C is satisfactory. There are gaps in your communication, some breakdown in the communication which requires improvement. And grade D and E means assessors struggled to understand you or they felt that the communication is breaking down. Okay, now let's have a look at both clinical communication criteria and linguistic criteria. Let's begin with the clinical communication criteria, and there are 5 criteria under this category. Criterion 1 is relationship building. This assesses how you open the interview. If you are empathetic with the patient, whether you maintain respectful and non-judgmental attitude throughout the conversation. Okay. Criterion 2 is understanding the patient's perspective. This is beyond asking questions. This is about understanding the patient's ideas, concerns, and expectations, and catching the patient's cues if they are giving any verbal or non-verbal. Then the third criterion is providing structure. Your interview should have a logical flow. There should be sequence in the interview. And if you're changing the topic, you need to signpost. Don't jump from one topic to another without any connection. Okay, so patient will be confused. Criterion four is information gathering. Now, when you gather the information as a healthcare professional, you are also an active listener. You listen to your patient appropriately, actively, and then you ask mixed questions, open ended first and then the closed ended questions. And you need to do the same in OET role plays. And the last criterion is information giving. While giving the information, you make sure that you speak as a healthcare professional. So you need to maintain the right tone. The language should be easily understandable for the patient. That means you need to speak in a lay language. Provide a bit of information and check if patient can understand. And your communication should be built on patient's responses. Okay. Now, the next criteria is linguistic criteria. There are 4 criteria under this category, and let's begin with intelligibility. This is not about your intelligence. OET never assess your knowledge. This is even not about the accent. You may have any accent, but that should not affect pronunciation. Use right word stress, use natural intonations, and maintain your rhythm. The next criterion is fluency. Now, fluency is generally taken as fast speaking, but no, maintain your natural flow. Slow, steady, and clear speech is okay, but choppy and uncertain is not. Don't hesitate too much. Okay, don't repeat or self correct. The third criterion is appropriateness of language. As a healthcare professional, you need to communicate professionally, provide warmth, and have the communication which is patient centered. And the last criterion is grammar and expression. Now, here I want to point out something. OET assessors don't count how many mistakes you make, but they assess the impact of your errors. If you're making a grammatical error which changes the meaning, you're absolutely going to be affected. But if there is minor slips in grammar which does not affect the meaning, or despite error, you are able to send the right message, then it will be less effective. Okay, so work on all the criterion, but all criteria, but don't let fear of grammar make you silence. Okay, so because this is one criterion out of many. Okay, so yes, the goal is communication. Now, today's takeaways. The speaking subtest has one unassessed warm up, and 2 graded role plays. You get 3 minutes to prepare for each role play. Use this time strategically. And in the next video, I'll explain you how to utilize these 3 minutes of preparation time and be confident before you even begin speaking. Number 3 is your performance is recorded and assessed later by at least 2 trained OET assessors. You are scored on both linguistic and clinical communication criteria. And grade B requires predominantly 5 out of 6 on linguistic and 2 out of 3 on each clinical communication criteria. Now, you know the test format, you know how you're going to be assessed, and you know what grade B looks like. In the next video, I'll help you to understand how to prepare thoroughly within 3 minutes of preparation time so that you will be confident while speaking. Stay tuned with me in the next video. And if you like this video, don't forget to share it with fellow healthcare professional who is preparing for OET. See you soon.